You tell me who I am.
They called you West.
Jim West.
Mr. West.
West!
Well, my name is James West.
A truly great man.
Brilliant.
Secret Service agent.
What's next? Come on, I'm waiting.
Man of action. He's James West.
Where's Jim West?
On the Wild Wild West. Weekdays at 4, 3 Central on MeTV.
Hello, I'm John Malos, and welcome to Connect with Me, live here on Comcast 187 and 43.6. Today, a program that you'll be interested in, I'm sure, especially if you have kids, if you have grandkids. We're talking about a topic, especially now in this day and age, and during this week when we're celebrating Thanksgiving tomorrow, we're talking about eating disorders, anorexia specifically. We'll have a live guest in our studio that is a recovering from anorexia, and it's a lifetime recovery. Your phone calls are important. 265-4331. We're back with our very important topic on the day in just a moment. Today is Ask the Expert today, and we encourage you to call in with your questions, a very important topic. Area code 559-265-4331. We're talking about eating disorders and anorexia. You know, this is a disease that millions and millions and millions of people across the country suffer from. We don't have the exact numbers, of course, here in the city of Fresno or all up and down the Central Valley, but basically it affects girls, mostly girls, over boys. And what happens is, you know, I don't know exactly what age. I'm not an expert in anorexia. I'm not going to sit here and tell you I am, but we have a guest today that is, because she went through it. But basically it starts when they're 8, 9, 10 years old, maybe when they get into middle school. You know, they'll look at themselves in the mirror. They don't like how they look, either in the stomach area, the hips, or their entire body, and they're not happy. And so what do? They feel they're overweight, or they might be fat when they're not. And so they basically stop eating. That's when they get into trouble, big trouble, and sometimes it can lead to death. Now I'm going to put this video up so you can see it, but I want to warn you, give this a disclaimer, a big disclaimer today, because some of these images are disturbing to say the least. Let's roll it, Ara, go ahead and let's take a look. And live in our studio right now is Jennifer Lombardi. She is the Executive Director of the Summit Eating Disorder and Outreach Program that started in Sacramento, but there is a satellite office right here in the city of Fresno. We'll talk about that. She suffers from anorexia. She's in recovery, lifetime recovery. Now you might be asking, why do we show those photos? They're so disturbing. Pictures are worth 1,000 words. We've heard that over and over again. I could sit here and talk about it until I'm blue in the face, but those pictures are startling and shocking, and that's the whole point. Call in 265-4331. Back in just a moment.
Ventura TV Appliance Center. We're the low-price leading brand's reliable advice place. The Whirlpool Dream Kitchen Get Yours Today place. Check this out. Right now, get huge savings on select Whirlpool appliances and pay no interest when paid in full within 6 months. At the hometown low price, think outside the big box place. Since 1951, Ventura TV Appliance Center. We're working hard to be your place.
Ask the Expert Day here on Connect with Me, 559-265-4331. We're talking about eating disorders and anorexia. And my guest is Jennifer Lombardi. I'm so pleased to have you here. Thank you. And you drove all the way from Sacramento.
Yeah, it was an early morning.
How was the drive? Good?
Not bad at all. It's a little bit of rain, so it's coming your way.
Oh, okay. All right. So talk to me about your story in anorexia and how it started, and you're recovering, and I guess it's a lifetime process.
Yeah, I mean, I've been recovered for about 19 years, and I actually grew up in Porterville, just south of Fresno, and so, you know, I would say that probably, you know, the beginning of my eating disorder was around the age of 17, but, you know, in looking back, I would say, you know, my struggle with dieting behaviors and compulsive exercise started, you know, as young as age 11, and taking diet pills and dabbling in dieting behaviors and sort of being uncomfortable in my own skin. But, you know, the turning point for my, you know, the beginning of my eating disorder was really, again, at the age of 17, and I struggled for the better part of about 5 years. And unfortunately, in those days, the treatment resources were extremely limited, particularly in this part of the state. So at that time, you know, I really didn't have a lot of treatment options. And so fortunately now that's changed. And so people do have options for treatment. And I'm certainly not an anomaly. Lots of people fully recover. And so I think that's a very important message for people to hear.
We saw some of those disturbing photos, and I hate to look at. I mean, I was looking, but it was difficult. And we've all seen those photos on the internet. We're familiar with anorexia. Right. Did your situation personally reach that level? Did you ever become that skinny, that thin? Just where you could see the bones sticking out?
Yeah, you know, I think in hindsight, you know, I can see things with a little bit more clarity. I think it's important for people to understand who've never struggled that when you're sort of in the trenches of an eating disorder, you don't see things clearly. You know, at that time, I think, you know, in my mind, I truly believed that I was overweight, even when I was at my lowest point, both emotionally and physically.
What did you weigh? What was the lowest?
So, you know, there's a very strict rule in the recovered world that we don't ever talk about specific numbers, because that can be very triggering for people. But what I will tell you is that, you know, back in those days,
you were thin.
I was extremely thin. And as a professional now in the field, and as somebody who's a licensed therapist that's worked with this population for the better part of 10 years, I know now that I was extremely at risk, and I'm very fortunate to have recovered.
Was it a near-death experience for you?
I would say yes. I would say at that point, you know, I was living literally on the edge, and I'm very fortunate. I realize now how fortunate I am to be here. You know, and people will, you know, people who know that I'm recovered will ask me, you know, do you have regrets about it? And I'm one of those people that I think things happen for a reason. So do I regret having an eating disorder? No, not necessarily. I'm very thankful that I've recovered. I'm very thankful that I've had the support that I've had and had the opportunity to help other people. But I do think it's important for people to understand that it's a very rare thing to fully recover without professional help and without a lot of medical intervention. And to try to do this on your own is, you know, you're really playing Russian roulette with your life.
Let me ask you, have you ever thought about, or do you know the answer to this now, years later? Why and how did this happen to you? What were you thinking?
Yeah, you know, it's one of those things that, you know, I would tell you in the last 5 or 6 years with the amount of research that's been done on answering that very question, it's really been enlightening. I mean, I've sat in a lot of professional seminars and just, you know, my jaw drops when I look at the research that's being done with really trying to figure out and get an answer to that $64 million question.
It's hard to understand.
It is. It's very complex, and it's not just one thing. So when I have family members ask, you know, I say, I sort of give them an analogy, and I say it's a puzzle, and there are 5 pieces to the puzzle of why. There's definitely a biological component. Usually people have a history of anxiety or depression. There's definitely a temperament piece. You know, typically people who struggle from a very early age, long before the eating disorder, usually are very high achieving, perfectionistic, difficulties with change
Is part
and
of an
conflict.
obsession? You're obsessed with how you want to look?
I would say obsessional thinking is really sort of the root. And that what happens is that you tend to be the type of person that worries a lot. You ruminate a lot. You worry about everything. And then what happens in life, when you hit a certain age, you sort of latch on to worrying about dieting and weight and appearance, and you realize this is one thing I can control. And it becomes a runaway train. And I think in our culture, what happens is we get praised for that. And so it becomes this vicious cycle. And when you understand that dieting behavior for somebody with those risk factors means something different, that's why you begin to understand why, just like with alcoholism, a drink means something different for somebody at risk for alcoholism. That's what makes it different for them. Dieting behaviors means something different for somebody at risk for developing an eating disorder.
Okay, if you have an eating disorder out there and you do have the courage to call in today, you don't have to identify yourself, but 265-4331. And eating disorders, I guess that can cover a lot of ground. You can talk about anorexia, but you can also talk about overeating too. Binge eating, I'm not sure exactly what that means, but maybe explain it. What is binge eating?
Yeah, so with binge eating disorder, to get very sort of technical, with our diagnostic criteria, if I'm going to put on my clinical hat, there's anorexia, there's bulimia, and then there's this broad category called an eating disorder not otherwise specified, which is sort of a catch-all term.
EDNOS.
EDNOS. And within that category, there is something called binge eating disorder. And so it's not its own separate formal diagnosis yet, although we believe that that's coming in the next year or so.
So what do you do when you binge eat? Is it like binge drinking or what?
Yeah, I mean, typically the easiest way to sort of conceptualize this is that this is a way that people use to cope. They use food as a way to comfort themselves, typically eating large amounts of food in secret, oftentimes, sort of hoarding food in preparation for that.
But do you hoard food and eat large amounts of food all at one time? Is that what binge
Very typically, although
means?
I will tell you in working with patients, sometimes that's not the case. They will eat sort of chronically throughout the day. It's not all in one setting. So it does vary a little bit based on the person.
Okay. We are talking with Jennifer Lombardi. She is the Executive Director of the Summit Eating Disorder and Outreach Program, and she has a satellite office here in Fresno, opened up less than a year ago. She started in Sacramento. We'll get into that and much more with our discussion. Like I said, if you have an eating disorder and you have the courage to call in, Turkey Day is tomorrow. We're talking about this very sensitive subject, 265-4331. Back in just a moment.
Fasten your bones and let's twizzle.
Weeknights, do the twizzle with me.
Everybody, start in doing the twizzle. Everybody, if you're ready to sizzle, you twist a little and you twist a lot. And when you really get hot, that's the twizzle. Twizzle, twizzle.
Weeknights starting at 9/8 Central on MeTV.
This is a topic that is top of mind, I would tend to think, perhaps this week, more so than ever, the holiday season, And yesterday we had a show here on Connect With Me talking about people that don't have enough to eat. We had a member of the food bank here, Jennifer, somebody representing the Salvation Army as well. You get families coming in that don't have enough money, they don't have enough food to eat, they want to eat. And here today, we're talking about eating disorders and anorexia.
Right.
It almost seems like, wow, is there a happy medium someplace,
Yeah.
Give me a happy medium, I'll be happy.
That would be wonderful.
Yeah, but anorexia, why does it affect more women or young girls than it does boys? Because across the nation, and before I get into that, let's put up a picture of a child. This affects girls more than boys. Why?
So, it's an interesting question, because I will tell you, in the last 4 or 5 years, I've assessed, I assess a lot of patients, and the majority of the patients we see are actually adults. Most people are surprised by that. Average age of onset for an eating disorder is, this young woman in this picture looks like she's probably fits the profile. It's typically between the ages of 14 and 16. And then there's a second category between the ages of 18 and 21, but predominantly females. And, one of the theories is that the temperaments are very predominant in women, but I will tell you, we see a lot of male clients, more and more, that are struggling with these illnesses. So it's not just young girls anymore.
Yeah, let's take a quick call here.
Sure.
Good morning. You're on Connect with me. How are you?
I'm doing just fine, thank you.
Good. What's your question?
Does the anorexia, I know you can keep it, I'm anorexic, and...
Yeah, go ahead.
Oh, okay, I'm sorry. Does it ever level out the longer, how do I explain this? I've had it since I've been 20. I've been down less to 100 pounds. And I'm just now at a peak to where it's starting again. I've leveled out, and it just, something triggers me, and it just goes back to zero, and then I just keep going up and down. I don't binge. What the problem is I just don't eat because I don't want to get sick.
Right.
Is there local facilities around here? I know she was talking about one. I came on the end of it, and I am under therapy for anorexia right now. But it's getting to that plateau to where it's affecting me, looking at myself, and I feel overweight. And is there a facility that is for plain anorexias or support groups in the local area?
Yes, and first of all, I want to commend you for having the courage to call in, because I know oftentimes, I've been the person for many years that's been on the receiving end of a call like yours, and I know how hard it is to pick up the phone. So I just wanted to give you kudos for being brave enough to pick up the phone first and foremost. And secondly, to answer part of your question, yes. You said you've been struggling for a number of years, and to be honest with you, that's heartbreaking for me. I would want to tell you that to have hope that people do, like I said earlier, really you are able to fully recover. The hardest part is accepting that sometimes you need more structure or more support, and that feels scary, for a lot of people. And it's not a reflection of something that you've done wrong. It's certainly not a reflection of your capability or that you're weak in any way. This is an extremely difficult illness to fully recover from. It's very complex. And, at our treatment centers, that's why we have therapists, we have dietitians, we work with a medical team. We truly understand that you have to have a team. I mean, we know that we can't do this on our own individually, so we have a team that coordinates to help people, to support them to recover. And truthfully, I think if there was a book or a magic pill that you could, take or read, somebody would have found it by now. So I would just strongly encourage you. You are more than welcome to contact our office, or look us up on the website, our website, on the internet.
What's your number?
So I'll give you the main number to our Sacramento office, which is 916-574-1000, and you can ask to speak to any of our clinical assessment coordinators, which would either be myself or Cindy Anderson, and we coordinate for both the Fresno office and our Sacramento facility. We're sort of centralized that way, or you can visit us on the internet and just look up Summit, SUMMIT, Eating Disorders, and you should be able to find our website and learn about our program here in Fresno as well as our facility in Sacramento. But I would just, I really want to encourage you to have some hope and know that you deserve to have treatment.
I appreciate everything you said, and I've had it for 30 years, and they said it would never go away, the therapist 30 years ago, and so it was something that would always be with me. And I've noticed that, I had it under control for a good 5 years, and then it hit. Something happened, and it hit. Stress is not a good friend.
Yeah, the stress thing is really the Achilles heel for a lot of people. Your story, I have to tell you, is common. It really truly is. People oftentimes when they call or come in for an assessment, they'll say to me, Jen, is it only going to be teenagers? And while certainly we do have teenage clients, without a doubt, I will tell you the youngest patient we've ever treated is 7, and the oldest patient we've ever treated is 67. And and we have a lot of adult women in their 30s, 40s, and 50s who have never had treatment before, either because it wasn't available to them or there wasn't a specialist in the area. So you by no means are alone, and please, I would just encourage you to just take a deep breath and make that call, because without a doubt, have some hope. It's absolutely possible to fully recover.
And again, quickly before we go to break, the phone number again is
916-574-1000.
Okay, and you do have an office here, a satellite office in Fresno.
We do, but we coordinate all the phone calls through our Sacramento office, so that's why it's a 916 area code.
I wish you the best of luck, and thank you for having the courage to call in, and wish you happy holidays, and I hope everything turns out for you.
Oh, everything is going to be just fine. I'm stubborn, but that helps. You've got a very good show. I love your show. And
thank you.
Thank you for having the courage to bring this up on TV.
Thank you so much.
To make more people aware of it.
Thank you.
Thanks for your call.
Have a happy Thanksgiving.
You too. Thanks for calling.
Thank you. We're going to be back with more of our interview and more of your phone calls with Jennifer Lombardi, the Executive Director of the Summit Eating Disorder and Outreach Program, in just a moment.
Is taking care of laundry taking too much of your time? Have you become a missing mom? With a new fast, efficient washer and dryer from Ventura TV Video Appliance, you'll spend more of your day the way you want.
This Amana Super Capacity Washer Dryer Pair is now just $6.99, and this heavy-duty Maytag Super Capacity Washer Dryer Pair is only $8.99.
Don't spend your life on laundry. Upgrade today at Ventura TV Video Appliance and save.
And quickly, Jennifer, before we move on to some other things, talking about the eating disorders. Now, you started your outreach program in Sacramento how many years ago?
12 years ago.
Okay, and the satellite office here opened when?
The end of April of this year.
Okay.
So it's a relatively new program.
So you're branching out.
We are. We have our Sacramento program. We have 2 different levels of care. Well, 3 in essence, I should say. So we have a full partial program where patients can be there 7 days a week. And we've actually had quite a few patients that have come from this area. So when they need a lot more medical intervention and need more structure, they can actually come there. And we actually have housing across the street. So if you're coming from outside the area, we've had families that have stayed and been able to participate. And then we have lower levels of care,
I want to get into the gory details about what you do in recovery as we put up another couple of photos, if we can, just looking at some people who have anorexia. They're suffering right now. There's a young woman there. I don't know how old she is, maybe an older lady, I'm not sure, can't tell from that photo there. But at your center, at your outreach program, let's say I have anorexia, I'm underweight, I'm not eating. What can you do to help me? Go through the step 1, 2, 3.
So really, when we're looking at providing somebody with treatment, there's really three pieces to that puzzle. First and foremost, we have to monitor somebody medically. So that's why particularly in Sacramento, we have a physician's assistant, a full nursing team.
Monitor their blood pressure, their heart rate, their
lab work. They get their vitals done on a daily basis. We work with their outpatient medical team.
So you have doctors on in-house.
Absolutely, because eating disorders unfortunately have the distinction of having the highest death rate of any mental illness. 10% of people can die, and so the #1 cause of death is cardiac arrest. So this is a very, very serious, life-threatening illness, and so it's extremely important that parents and patients recognize that this is, even though you might think this is not that big of a deal or it's sort of a phase, it is extremely life-threatening. And I see a lot of patients and families coming into the treatment center to have an assessment, really just sort of thinking, I need once-a-week therapy, it's not that big of a deal. Right. And when we have our nursing staff evaluate them and get vitals, or we get lab work back, they're shocked at how medically compromised they really are and how much treatment and intervention they really need.
Do you see repeat offenders come in?
Again
and again and again.
We do. We unfortunately, relapse is one of those things that happens for people. And the caller earlier really sort of hit the nail on the head. Stressors are those things that sort of trigger, which is common in any issue in life, whether it's
during
substance
the holidays,
abuse.
You're stressed out and you can trigger it, right?
Absolutely. And I always say, with an eating disorder, whether it's change is really what I say to patients, and change, for somebody in recovery from an eating disorder, we don't differentiate between good change and bad change. A lot of times families will say, oh, you're going away to college. That's a wonderful thing. I say, yeah, it is, but that's still change. And so it's stressful. So anytime there's stress associated with change, you need to be mindful of that, because it could be an opportunity for relapse.
I'm trying to understand this, and maybe it's not for me to understand, it's just for me to be compassionate and leave it to you professionals to deal with the problem. But, you know, if I miss a meal or two or three, boy, I start getting lightheaded, my stomach hurts, I start feeling weak, I feel like I'm going to collapse. I don't understand how anyone can go for a long period of time without wanting to eat.
Right, and so I think this is the piece, and I don't want to bore you to tears with all the
no, that's okay.
all the biochemistry.
That's okay. I'm just trying to put this together in my head, and I'm thinking, wow, how do you do that?
Yeah, and I think this gets back to what I was saying earlier with the research that's being done, and I think the difference is for people who are at risk for developing an eating disorder, the benefits that they get through the behaviors sort of overshadow the the side effects that you're identifying. And those benefits are reduced anxiety, sort of what we call cognitive narrowing. So if I'm the type of person that's a constant worrier and I'm anxious all the time, with these behaviors, for me, they mean something different. So if I begin to diet, if I begin to restrict, or I begin to compulsively exercise, for somebody who's not at risk for these behaviors, they would feel, you know, exhausted, cranky, all of the things that you mentioned. But for somebody who's at risk from a biochemical standpoint, from a brain chemistry standpoint, what happens for them is they might feel those things, but what they also get are some benefits, which is I feel a little less stressed, I feel a little less anxious, I feel more focused, and so I like that feeling.
Yeah.
I feel like I have a little more sense of control. I feel like I worry less. So I like that feeling. I like that sort of high, that numbing feeling.
What's too much exercise?
You know, in our culture, this is a tricky question, because I think, you know, because there is so much emphasis on trying to get people to be active, which is a wonderful thing, there is, you know, it can go too far. And I think, you know, having a healthy relationship with exercise means you know that you're listening to your body, you know, you sort of exercise and do things you like, but you also are very in tune knowing when to stop. So what happens when it becomes too much, you're exercising when you're sick, you're exercising with injury, you're not good. Not good at all.
Okay, we've only got about 3 minutes left, and I only got two very important questions in, and one is, what's the difference between an eating disorder and, say, someone who is dieting? Okay, is there a big difference?
I think the distinction is that, you know, can people diet? And I say this to my, you know, I have friends obviously who diet, and they've learned to not ask me as a recovered person about dieting, because of course I have a very strong opinion about that. As a recovered person, I will never diet again.
What do you think of these places like Jenny Craig or Weight Watchers? Are they
I think for
good,
some,
bad, or indifferent?
I think, you know, for some people, those programs can work, and I think that's great. I think if you are talking about a person who is at risk for an eating disorder from a biochemical standpoint, from a temperament standpoint, they start to engage in those behaviors and that type of programming, it means something different for them. And the closest parallel and example I can give to you is alcoholism. So can some people have a drink every once in a while to unwind? Sure. But for somebody at risk for developing alcoholism, having that drink means something different to them. And it's a difficult distinction to make, but we're getting closer to being able to make it through research.
We're getting close to the end here. I don't like the size of my waist. I wish it was a little slimmer. What can I do about it without being obsessed about it like a lot of people get?
So the things that I would tell you to do are the things that in our culture sort of stop people in their tracks, and that is learning to stop vilifying food as good or bad, learning to eat when you're hungry, stop when you're full, learning to exercise and do activities that you love to do, things that you'll continue to do instead of, you know, and I always say to people, an interesting sort of challenge for yourself is, you know, I say I have to go run. Well, you don't have to. What do you want to do? Do you want to go play basketball? Well, then you should play basketball instead of running, because you're much more likely to stick with that. So finding things you enjoy, that's
We've got
key.
30 seconds. Let me tell you what I've done in the past. I want a Snickers bar. I'll chew the Snickers bar like in its entirety and then spit it out. Good or a bad idea? I just want to get the taste of it. Do a lot of people do that?
In the world of
I've
eating
done that.
disorder
I don't do that all the
therapists,
time. I don't. That's not a chronic with me, but I've done it on occasion.
Well, I would say not good. Why would you not want to? What's wrong with a Snickers bar? What's not to love?
Don't want the calories.
Well, what's wrong? I mean, you know, and then you obsess about the Snickers bar because you don't let yourself have it.
Yeah.
So have it and move on is what I would say.
Jennifer, it's so good to see you.
Thank you.
And I hope you
Nice
come
to
back
see you.
sometime, and good luck with
Absolutely.
the business and continued success in trying to help people out with this very important disease. And I hope you come back soon.
Thank you very much for having me. I appreciate
All right.
it.
Jennifer Lombardi, the Executive Director of the Summit Eating Disorder and Outreach Program. Tomorrow's program will be on tape, as will Friday. Hope you have a happy Turkey Day. We'll see you back here live on Monday.